Hey everyone, I'm here at Pole Art Tahiti, and I just wanted to talk about tendonitis actually. It's very common in my clinic that patients will come in and they will say, I've been diagnosed with tendonitis, or I have tendonitis of the knee or the elbow, or maybe they even self-diagnose. What's funny about this term is it doesn't mean anything. I mean, it means there's inflammation at the tendon, but doesn't really tell you what's causing it. In fact, when I hear a diagnosis from another doctor that's tendonitis, I kind of blow them off. I go, they don't know what they're talking about because they're just pointing at something and saying, oh, it hurts. And then you, the patient, may have paid a lot of money for this expert opinion. And it really frustrates me. So, the big question is, what actually is tendonitis? Well, because it's not a diagnosis in itself, and because it just represents inflammation in an area, it means there's another cause somewhere aside from that tendon itself. The tendon is actually the symptom. So, usually what causes tendonitis is improper use, poor biomechanics, and very frequently what it is actually the primary muscle that's supposed to do the work is not doing the work. It's injured or it's overused, and then as a result another muscle has to come in and take up that workload, and then that tendon actually the whole muscle starts to feel a lot of strain, and the tendon as a result also feels a lot of strain, and so it continues to irritate and tear at it. And then you get inflammation there. Another common cause of tendonitis is just, it's new, whatever activity you're doing. You may need some time to adapt. A lot of, especially new pole dancers, get very excited, and then what ends up happening is they go, I'm gonna go all out, and they start training so much, so hard that it doesn't actually reflect the way that their body's been trained thus far. Many of us come from more of a sedentary lifestyle of just sitting. And so these muscles, these joints, these tendons, everything needs to have time to adapt. Muscles typically can adapt very quickly, but tendons, cartilage, all that to actually get stronger, it takes a little more time. That's why sprains can take a significant amount of time to heal. Because they're not very vascularized, they don't replenish, they don't heal that quickly. So if you need to conditioning your muscles, even if you're very rigorous and very good with your techniques, sometimes you may actually experience some symptoms for a short period of time. So be patient with yourself. If you're experiencing, for a lot of pole dancers, it's in the shoulder, it could be in the knees if you're a parkour athlete, it could be in the elbow. I only have one arm here, so I can't really point at this. Medial elbow here. Frequently that's not actually the cause. So I highly recommend that you don't try to treat tendonitis directly. Look elsewhere. Primarily because frequently if you're trying to treat the tendon that's already irritated, you're going to irritate it more. You may actually prolong the injury if you're too aggressive about doing therapies to it. So highly recommend, consult a medical professional, talk to whoever's taking care of you, but frequently the answer is not actually in the symptomatic area itself. Anyway, I hope this message was beneficial to you. I'm gonna get back to my work, sitting on this moped inside a pole studio. And I'll catch you guys later.